I don't know if you can remember when you were in middle school. It may have been a few years ago. But it's a difficult time at best. Your body is changing, your hormones start raging, you're not sure where you're going. You may have been in an elementary school with the same teacher throughout the year. Now you're going to a new school, you're changing classes, you're feeling insecure. You don't know if people are going to like you or not, and you're feeling different because you know that you have to get home to take care of Grandma. And so for caregiving youth, they're not only going through normal adolescent changes, physically and emotionally and developmentally, but also they don't have an experience bank in caregiving or in life skills, and so they're really struggling extra hard.
CYP has helped me emotionally with dealing with the grieving when my grandma passed, also with how to support my grandfather, help my grandma go through it, with what she had to deal with getting diagnosed with cancer. It's also helped me with trust. Wasn't really trustworthy, but with certain events we've done and exercises, built up my trust. One thing it's helped me form was friendships. It's introduced me to a couple certain kids I probably would have never met on my own. It's brought me together meeting other people who deal with the same problems I do. Some might have it a little easier, some might have it a little more harder. But it helps us get together, talk, more supportive.
My mother had her first child before her 16th birthday, and when she died, my sister was the oldest of this family of 6. She was 20 years old and she was in college, and my father said she should stay in college and graduate. And I had another brother older than me, and he was 5.5 years older than me. And he was also in college, so I was the oldest one at home at 12.5. And my dad said, "Artie, you're in charge." I said, "Dad, what does it mean? What do I do?" He said, "Well, make sure everybody gets a bath once a day, and they do their homework, and that you'll have to walk them to school and walk them back, and take care of them." And the youngest child was 7.5 months old, so we realized we had to get some kind of help to take care of him. I learned what I had to do was make sure that they all taken the dentist and all those kinds of things. I just had to stoke the coal. We had a coal furnace in those days. Crank my dad's car to get it started in the morning. and a whole host of duties to walk the children, exercise, all those kinds of things that I guess 12 and a half years old I didn't expect to do. Although my mother, even before she died, had me doing all kinds of grocery shopping because she couldn't go and do it. So I guess I was trained for responsibility at an early age.
I got involved with CYP in my 6th grade year, 2006. I remember going into the cafeteria and I saw a little table and I read the pamphlet and I just knew that it fit my criteria and what I was going through.
What were you going through?
I was going through having to take care of my sister at a young age, like during the summer before 6th grade. She got sick with meningitis and she got paralyzed. So I had to be there with her and I felt young and I felt like I had a big responsibility to take on. CYP helped me with my caregiving a lot with dealing with being patient and learning what my limits are and when to say no and how much I can take. Caregiving brought me into the nursing field. I fell in love with the hospital. I know it doesn't sound good, but when I went to the hospital with my sister, I just loved the environment and loved being able to help people. And that has brought me to want to go into the nursing field. When I went to Camp Treasure, they did an activity where if someone was going to fall down, they taught you how to support them and not break your back, bring them down slowly. And they just taught you how to be patient and just, if you need a break, just go and take a break. They taught you how to cope with your feelings. If you're feeling too stressed out, going to your room and listen to music or scream in your pillow or cry or something to make you feel better so you don't feel so stressed out. Because there's only so much you can take.
When I was in nursing school, no one taught me about this. Educators have not learned about this yet, the overwhelming majority, much less the public. And so these kids are really precious. There's a national effort now to teach children empathy, that's a good character trait for them to have for the future. But I can tell you that our kids know empathy in spades. They do not have to be taught it. In fact, they could probably teach others.
Before working with the Caregiving Youth was with hospice. And when I was at hospice, one of the things that really came to my attention was the number of young children that were caring for people who were sick. And when I had the opportunity to join the Caregiving Youth Project, I thought, wow, I'm going to grab that. That sounded like something I would really want to do. These children have really been unnoticed and unidentified. Sometimes we call them the hidden children. What we do with the students is that we provide services for them and their families. In school, we do support groups where the students get to meet other students who are caregivers. And many times they are so surprised when they meet the other students in their group, because sometimes they're their neighbors or acquaintances and they had no idea that they had similar responsibilities. We also offer home visits where we can go to the student's home and meet the family and the person who is receiving the care from the child. And we assess what their needs are. Oftentimes we're able to connect other agencies with them to assist them with medical care and dental care and other services that they may need.
I'm so pleased to be a part of this organization because we are giving the support to these youths that go to school all day and then have to go home to take care of family members who can't take care of themselves. And we're going to stand by these students and by these youths continuously. And that's why I'm so proud to be part of such an organization that's making such a difference. Hearing about what the organization's about, the mission of the organization, and knowing about and hearing about all the youth that not only go to school every day, but then have to come home when you'd think they'd be out visiting with friends and playing different games, but no, having to spend time with family members because those family members can't take care of themselves. And hearing about really a hidden population that this organization stands by and offers the support through education, healthcare, family, so they can be productive citizens in our society, making sure that they stay in school, the support for them so they can stay in school, to graduate. You know, when we hear about the kids that drop out, that don't complete their 12 years of schooling in our educational system, and we ask ourselves, why do they drop out? I would be guess to say a very large portion of those kids are coming from backgrounds where they don't go out after school, where they do need to take care of family members who aren't able to take care of themselves when they come home from school. And you think about the time commitment there. And that's where I really got very excited about what this organization is about.